It's interesting. Someone was chatting with one of our physicians in a forum, and he's been around for a couple of decades. And you mentioned earlier that some of the stuff that people are talking about now, it's not necessarily new. The conversations maybe have happened before. So I often get asked, well, what is different? And I was particularly struck by this physician who was asked the same question. Well, if these are things we've done before, what's different now? And he said, I thought I knew what a social worker did. I worked with social workers. I thought I knew what a pharmacist or consulting pharmacist did. I worked with them, but not in this way. So something's to be said in the way in which we're interacting. It's not necessarily a different issue or not necessarily different content, but the way in which we're interacting seems to be changing the dynamics of the conversation. I don't know, again, if you're seeing that, the way is, it's just different.
Yeah, I totally agree with you. I mean, I think that one of the challenges in moving forward on this is that we do have a number of people in all of our agencies who go, what's new about this? I don't understand this. I mean, we have a partnership with this agency, we have a partnership with that agency, but I think we've taken the whole level of collaboration, the whole level of partnership, and really moved it, in my view, to integration. Right, we're integrating our systems.
We're turning things on its head, in a sense, because I know you've talked about this. The starting point isn't, what can we share or what can we do? It's how can we help the resident, and then working backwards from there to figure out what's in the way, and then of course we're going to share. We just have to figure out how to do that.
Hopefully 10 years from now, and even probably less, but our youth, the people, our future will be healthier. They'll be more engaged. Older adults, long term, will live longer. There'll be less impact, less crime. More educated individuals, a higher literacy rate. I mean, I think I think we just have a discussion around what we're doing here to say, imagine the future.